Good afternoon and welcome to the 150th of the COVID calls. This is a daily discussion of the COVID 19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today we're going to talk about siblings during the pandemic, and I'm having my special guests today to mark this 150th episode, and that is my brothers and sisters, who I will bring out and introduce to you in just a few minutes. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @USOfDisaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and future topics, and please feel free to suggest yourself as a future guest. As of today, October 16th, 2020, there are 1,101,007 deaths from COVID-19 globally, according to the Johns Hopkins University Coronavirus Resource Center. There are 8,027,412 cases of COVID-19 in the United States, up from 7,927,975 reported yesterday. There are now a total of 218,266 deaths reported in the United States from COVID-19. That's up from 217,155 reported yesterday, yet another day with more than 1,000 deaths day to day. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way. I'd like to continue that now. Headline is: two Navajo sisters who were inseparable died of COVID just weeks apart. This was written by Shoshana Dubnow and was published August 26th in Kaiser Health News. Cheryl and Corinna Thin were almost joined at the hip. The sisters, both members of the Navajo Nation, shared an office at Arizona's Tuba City Regional Healthcare. Cheryl conducted reviews to make sure patients were receiving adequate care. Corinna was a social worker. Their desks were just inches apart. They lived together with their mother, Mary Thin. They helped raise each other's children, and they died just weeks apart at ages 40 and 44 after falling ill with COVID-19. The Navajo Nation was ravaged by COVID-19 this spring. In May, it reported the highest per capita infection rate in the United States. As of August 21st, the sisters were among 489 members of the reservation who had died of the virus, according to the Navajo Department of Health. Experts attributed the spread to the prevalence of multi-generational housing and poor sanitation infrastructure. Many homes lack running water. Like medical centers across the country, local hospitals across the Navajo Nation experienced shortages of personal protective gear. In early March, Corinna, without personal protective equipment, saw a patient who was showing symptoms of COVID-19, according to her sister, Chris. Corinna made sure the patient was comfortable and asked what else she could do to help. A couple of days later, that patient died and a test for COVID-19 came back positive. Within days after that, she got sick really fast, Chris said. Corinna's first concern was for Cheryl, who started showing symptoms of the virus around the same time that she did. Cheryl's job as a utilization review technician required face-to-face interaction with patients to verify their insurance and discuss workers' compensation. She had underlying health conditions, including rheumatoid arthritis. Chris remembers calling Cheryl on her 40th birthday, March 19th. Cheryl joked about how, as the baby of the four siblings, she was still young and pretty, but she also complained that it was difficult for her to breathe. She was admitted to the Tuba City Hospital the next day. Corinna's condition worsened as well, and she checked herself into the emergency room at Tuba City on March 21st. Hospital staff tried assisted breathing treatments on her to no avail. Cheryl was airlifted to Flagstaff Medical Center on March 24th. She never knew that Corinna was briefly in the hospital with her. Corinna was airlifted to Banner Thunderbird Medical Center in Glendale later that night. Chris said that the last time she spoke with Corinna, she was still in the ER. She just messaged us saying she was going to get flown out, that she loves us, and that she was going to be back, Chris said. That was the last time we heard from her. Because of shortages, the sisters weren't tested for COVID-19 until they were transferred out of Tuba City. They both tested positive and were then intubated at their respective hospitals. Cheryl died on April 11th, and no family members were allowed to be with her. I couldn't even hold my baby, her mother said. I couldn't even hold her hand when she passed. The family had a small service before burying Cheryl next to their father, Navajo Police Sergeant Jimmy Thin Sr., and Cheryl's ex-husband, who died in January. Even after their marriage ended, the two remained close and co-parented Cheryl's son, Kyle. Chris says the whole experience felt very lonely. Numbed by the pain of Cheryl's death, the family shifted their focus to Corinna. You tell yourself that we just need to get her healthy enough to come home, Chris said, and then all of a sudden she's gone. Corinna died on April 29th, 18 days after her sister's death and 2 weeks after her birthday, which she spent on a ventilator. Although she was unconscious, her nurse sang happy birthday. Corinna's oldest son, Gary Warito Jr., had tried for weeks to take leave from his Fort Bliss Army post in El Paso, Texas. His superiors declined his requests out of concerns he might contract the virus while on leave. Separated from his mother by hundreds of miles, Warito tried to reach her through prayer. I would burn cedar, he said. I was trying to talk to my mom. I was telling her, Mom, you're going to get through this. You're going to come home. You're going to meet your granddaughter. Warito and his wife were expecting their second child. The baby would have been Corinna's first granddaughter. Warito remembers his mother as a model Navajo. She left the reservation to get an education, and then she came home, he said. She could have worked anywhere else as a social worker, but she chose to help her own people. Corinna was particularly effective at the hospital because she spoke English and Navajo fluently. The Navajo language helped the United States win World War II as a secret code for communications because it remained mostly unwritten at the time. A colleague said, a lot of people aren't fluent in Navajo anymore. When elderly people would come to the hospital, they don't speak a lot of English. She was there to talk with them. It would really surprise people. Both sisters left behind young sons. Corinna's son, Michael, is 14, and Cheryl's son just turned 12. The cousins are keeping each other company, reminding Mary of the way her daughters behaved. Warito said he sometimes forgets his mother is gone and expects her to come home from work. My grandmother told me it's a little peace of mind that I'm home now, he said. It kind of fills that void that my mom and my aunt left. Okay, I'd like to turn to my conversation for today. And to do that, I have my guests with me, my siblings, all but one of them. And so I did not prepare fully written out biographical statements for each of you, but I hope maybe we could just go around and everybody could introduce themselves a little bit. And Jen, can I start with you?
Sure. Hi, I'm Jen Knowles Lerma. I live in Austin, Texas with my husband and 3-year-old son. And yeah.
What do you do when you're not doing that?
I work for a software company. And we are all 100% working remotely. And it's actually been a really smooth transition. So I'm very, very fortunate to work where I do.
How big is that company, Jen?
Baxter Planning. We're a software company for supply chain planning. And my husband actually has been a stay-at-home dad since we had our son. And so we are also very fortunate in that because we didn't have to worry about like juggling, working from home and watching the child. So we know we're extremely blessed having that situation.
And you've all been home this whole time?
7 months.
I love the way you said that. Dave, who are you?
I'm the guy who can't seem to get his mic unmuted. Yeah, I'm Dave Vieira. I live in San Antonio, Texas. I am a father of 2 now, with the recent arrival that's 7 weeks old today. When I am not being a part of this call and hassling Scott, I am a theater consultant for a firm based in Dallas with an office in San Antonio. And we are back to work. We initially worked from home, but following Texas guidelines, we have been back in the office here and there, and we are back in the office full time now. But we have been very fortunate that, I work remotely, travel a lot, which has been basically on hold. But we were already prepared to work from basically anywhere because I spend 50 to 60% of my time working from a hotel or an airport anyway. So. You're muted.
I forgot the only single thing I have to remember is don't mute myself before talking. So you're in the office now, right, Dave? I
am in the office now. Yes.
It seemed quiet.
Yes, it is much quieter here than being at home with the 3-year or the 2-year-old and the 7-week-old. It gets a little noisy and a little rambunctious at time. I've learned how to cram an awful lot of work into nap time.
Okay, let's keep going. Lindy.
Hi. My name is Lindy. I live in Austin, but right now I'm actually in San Marcos in my office at Texas State. I work for the sociology department as the grad program specialist. So I help with recruiting and retention and administrative support for all of our graduate programs. But I live in Austin, so I make the commute, and I'm in the office twice a week, typically just 2 days a week. So, and my husband also works at Texas State. And so we kind of alternate on which days we're coming up to campus. So one of us is at home. So.
And the students are back?
So Texas State has chosen to have kind of a hybrid model. Technically, yes, it's in person, but the majority of the courses that are offered are online, or they have the option where it's kind of a hybrid, half online, half in person. And also students can choose to do modifications. But yeah, students are here, people are living on campus, and our office is required to be open since the university is open. So there has to be one person in our office physically here from 8 to 5, Monday through Friday.
Otherwise, you're not open, technically. Okay. Okay. We'll return to that discussion, I'm sure, at some point. Thank you, Lindy. Stephanie.
Hi, I'm Stephanie Knowles Edelton, and I live in Leander, Texas, which is just right outside of Austin. And I work in Austin, so I actually just ran back home because it's actually quieter at home than school. So I work, I'm a teacher, second grade teacher at Highland Park in Austin. Love it. And my husband, Jason, is a teacher a couple miles away from my school in Austin, and he's a third grade teacher. So we have had an interesting time with all of this, but we're back in school, and this is the second week with kids. I've had 4 kids in my classroom and also teaching online. So that's been an experience. So not a good one.
So just so I understand, again, so you're teaching and you have the students in the classroom, and then you're also doing a remote population of students who may return to the classroom, and then also students who probably will not return to the classroom.
Right. So we give out surveys every few weeks just to see what the families are comfortable with, and we're doing a phase-in model. So we were at 25%, and now we're at 50% starting next week. So I'll have 6 kids total, but some teachers will have 12, but still teaching the online at the same time. So
complicated. Okay. Yeah, thank you. Okay, Jeff, last but not least today in our roundup.
Sure. Hey, everybody. Jeff Knowles. I'm Scott's younger brother. I live in Oakland, California, and I work for a transportation consulting firm. I'm a city planner, and I manage our Oakland office here. I've got my wife is here with me in California, and she works from the nonprofit sector. And we have a daughter who's just about to turn 2 next month.
Amazing. Thank you all for making time to do this. I have one other brother, Freddie, who I just want to say hi to. Hey, Fred. He's not with us here today. It's something else that kept him, but thank you. And it's good to see each of you. And I guess for those who are keeping score at home, we're all related, but I have, let's see, my mother and father who divorced and each remarried. And so I grew up with, in the house with my mother and stepfather, with Dave and Freddie, and then also was frequently in my other home with my father and stepmother, and that's where Jen and Lindy and Steph and Jeff grew up. So for those who are listening, maybe that will help sort out a little bit of it, although these days, I mean, when I was much younger, I felt like I had to explain that much more. And families, I think people have gotten so much more used in our society to sort of, we might have even used to call them complicated family arrangements. I'm not even sure we do anymore. There's so many multi-generational families and blended families these days. But why don't we talk a little bit about just what it's been like to deal with the pandemic and keep family relationships going. And I guess I would start that conversation. I'd like to hear from each of you a little bit about the early period of the pandemic, which I know must seem like a long time ago now. But cast your memory back to like February, March, and what it was like for you, particularly to like deal with lockdown and like just how you managed that in your own house and communicating with each other through that time. Do you all remember that? What do you remember about that? Let me just, I'll start by sort of asking people, but then everybody just jump in. Lindy, can you mind if I ask you first?
Sure. Yeah, I remember it very clearly. March 13th was the last day of being on campus in our department. We had a kind of a roundtable discussion about how maybe we'll be gone for 2 weeks, take home a laptop, and it was almost like a joke, like, okay, well, we'll see, but see y'all in a couple weeks. Like, it was right before spring break. And my son, who's 18 months, he was back in March, he was 11 months old. We pulled him out of daycare because we just were trying to be safe until things happened. And so the first couple weeks, it was a lot of, anxiety about like what's to come, a little bit of just uncertainty about how actually scary this could be, if it really was going to affect Austin or our area, or if it was just going to affect other people. It was kind of more of like, okay, well, we're doing this out of caution because it's bad other places. But yeah, it was stressful. It was the first time trying to handle work, but also take care of our son, who is very active, and also a marriage, communicating and figuring out our roles and what's fair. And yeah, so the first couple weeks were pretty difficult. It was not a great time.
Anybody else want to share those first few weeks?
I'll share just real quick, because the same thing, March 12th was a Thursday, and so it was almost spring break. And I remember, like, I didn't even get to say bye to my class, like, the normal, like, bye, see y'all tomorrow. And then we got the call, like, we weren't going to school that Friday. And then I never saw them again. We saw them on Zoom, but just such a weird time. And like Lindy said, it was kind of like, okay, we'll just see you in 2 weeks, probably. It's not that big of a deal. And so I think that was the hardest part of it all, was that we just didn't know. And so that, like, March, pretty much the whole month of March was just like the waiting game. And so that was really tricky, because it's just, you're waiting to see what was going to happen. And there's a lot of unknowns.
Yeah, I think, being in the Bay Area, the government was really attuned to it and starting to lock us down, I think, earlier than the rest of the country. And I had gotten sick basically a week before we closed our office, and still to this day don't know if maybe we actually got COVID in our household. We all were sick for about a month, just some of the symptoms of it. And so, yeah, I left and took sick leave, and then we closed our office, and so I never, didn't come back. and it was really stressful. I think everybody felt this way. Anybody working parents, of how do we manage a workload with 2 working parents? And my wife had just gone back to work, starting a job in January, new job. So we were waking up. I was waking up at like 5 a.m. to try and get in a few hours of work before our daughter woke up, and then my wife would take over a few hours, and I'd try and work in the bedroom with our door closed. But Emmy Lou would be knocking at the door, and then break for lunch and try and switch, and then somehow I'd be up late, and so nobody was sleeping. Everybody was confined, and in California we've got these fires that are raging. So sometimes that locks us in our house, in our 2-bedroom apartment, and so it was just chaos until we finally made the decision to go, restart daycare, and did that after about 2 months. And it was, I think every parent has to weigh the risks involved, and for our daughter, also very active and very social. She just thrives in daycare, and so our daycare did a very, very small, limited group to return. So we were part of that limited group, and since then it's been kind of a godsend to have, that availability to keep us, sane and working.
Do you think you had COVID?
I don't know, and it was before there was any testing available. I mean, it was in February, late February. So it's. I was doing some work down in Santa Clara County, which was at that time kind of a hot spot. Did some events that maybe could have picked it up. Don't know, but it was certainly kind of a cough that didn't go away for a few weeks. So I don't know. It would have been certainly a milder case. No hospitalization, no true breathing difficulty, but I don't know.
I remember in that early period too, because when did San Francisco go on lockdown, Joe?
Second week of March, I think.
It was really early, and I think for the rest of the country, it was strange, and sort of talking to you at that time and seeing the pictures from out there, and I interviewed a couple of people who were based out there at that time, and they were describing empty streets and things like that we hadn't gotten to yet here in New Jersey. We were going to get to that really soon, but one of the weird things about this pandemic, and since we are a big family and we're dispersed over different parts of Texas, and then you've got the West Coast lockdown, Jeff, and I got the East Coast lockdown, we actually amongst all of us kind of saw this thing unfold in the different times as it did. But I have to say, in those early period when you were describing what it was like out there was part of me that thought, oh, how weird for him. Like, it didn't quite dawn on me that I was about to go through the exact same thing that you were going through there. Jen, what were the first couple weeks like for you?
So I had a similar situation, I guess, as of Lindy. Our office made the decision to do like a test of going working from home to see if we could all handle it. We had the right infrastructure. Everyone had the right just monitors and everything. And so they're like, okay, y'all need to start working from home, like department by department, just to try it out. And then all of a sudden that changed to like, okay, everyone has to work from home, but we'll see in a month if you can come back. And that's just been a lot. And then finally they were like, we can't keep saying we'll come back. So it's been like, we'll come back indefinitely when things are better. So I think it was just a little tough because of all the uncertainty at the beginning. But it's been okay. It's just across the board, the uncertainty has been kind of just increased anxiety and just not getting to get out of the house and see friends has been really tough. But it has been nice. I'm pretty sure my son never wants me to go back to the office because I see him, longer in the morning, and then I eat lunch with him. I can help out in between calls and stuff. So that has been nice, but it definitely has been, it's a long transition period. Like at first I had a hard time focusing on work when I was working. It's just different. Being in my bedroom, because we live in a 2-bedroom condo. I don't have room for a desk, so I'm like working on a table at the foot of my bed, just trying to make the best of everything. So yeah, it's just been very different.
Kids are going to have such a different memory of this. I mean,
Mhm.
what you were just talking about, Donovan's like, the pandemic, at least extra mom time, it shouldn't end. I mean, what a bummer to have to go back to some kinds of normal are not great for kids.
Yeah.
They'd rather have a lot more attention, I think. I've tried to think about this from a kid's perspective sometimes, and it certainly for me, those first few weeks just felt like a snow day. I mean, it
Yeah.
felt like a snow day mixed with like an apocalypse movie, where like the cause of the snow day was something that was impossibly terrible, but very hard to assess or experience because it was all happening in hospitals, whatever. So the way we lived it was just the way you all described. It's like, well, I got to take everything home from the office that I might need for a couple weeks until I get back. And of course,
Like a super nervous snow day.
super what?
A super nervous snow day.
What was your time like, Dave? First part of it.
Yeah. So these guys, they pretty much captured the essence. The only thing that I wanted to add was down here in San Antonio area, it was, the thing I responded to the most, or the thing that I remember the most that sticks out, is like listening to them talking about this, new virus emerging in China on NPR, and like kind of listening to that build up. And like a couple weeks before, middle of March, like, hey, honey, maybe we should get a few extra groceries this week. Maybe we should get a few extra, like, man, I don't know. What if this thing gets weird? And worrying about our friends in Seattle, and, worrying about people on the East Coast and all my friends that work in the arts. And I was like, maybe we should be a little prepared for this. And then like that Sunday before lockdown started, things just being absolutely crazy town. Like trying to go to the grocery store and for my regular grocery run that Sunday morning, and it was like packed and everything was bare and people were looking at each other. Like if you stood next, like I felt like I had to sneeze in the store and I thought I was gonna get left for dead there. Like it was like just a very unfocused pandemonium that was going on. It was kind of calm, but like lots of just under the surface nerves that I felt like really kind of came to a head whenever they started rolling out lockdowns and things started closing up and people started staying home. That I'm sure that everyone here, well, I guess with the exception of you and Jeff, the girls and I have a similar experience being in Texas of people being like, no, this is just a flu. Like, this is no big deal. Like, government's not going to tell me what to do. And that has been from the beginning. Like, I remember going to pick up my son from staying with his in-laws during the day because our house was too small to be taking care of, two parents working at home and a almost 2-year-old. So like, we go out there and masks, nah, we're not social distance. Nope, not going to do that either. Like, no, seriously, this is serious. Like, I realize you're in a quote unquote rural community, but like, you could still get it. So,
yeah. Dave, since I want to just actually, I'm want to put you on the spot a little bit. This is a mask. This is one that I have. Since I studied disasters, I keep tabs on things. I bought some masks in early January because I was following what was going on in China. I guess it would have been around mid-January. And I don't know if you remember this. So like I talked to the way things were pre-COVID time. I would talk to each of you or text with each of you usually in the morning on my Amtrak trip in to Drexel, or in the evening on my walk from the train station home. Like those are time periods in which that's like sibling time for me to catch up with people, which means you're all sort of used to receiving sort of rando texts from me somewhere between 7:30 in the morning and 8:30 in the morning and 6 and 8 p.m. or like a random call where I sound out of breath because I'm walking. This particular morning was early March, and I had the mask on the train. and people were just starting to wear them here in the Northeast right at that time. The first death recorded of COVID was in New York, was March 1st. And in Jersey, people were not in general wearing any masks. And I wore this. There was one other person on the train. I'll never forget this. And I talked to you, Dave. We were talking on the phone. And I said, oh, I'm wearing the mask. And you said, oh, you're not supposed to wear that. You totally let me have it. You were like, you're not supposed to wear the mask. The masks, other people need the masks. The mask, they've already told you were. And of course, this is what the CDC was reporting at that time, was we weren't supposed to wear the mask.
You're damn right they were.
And okay. So that's a separate issue. This is a brothers and sisters thing. And the point I want to make about this is that, okay, so first of all, I could have got this information anywhere I wanted, but you know what I did? I took the mask off and I put it in my bag. And I didn't wear a mask again until much later, because you chastised me for wearing the mask. And I want to just make that point, because I think that we rely a lot on each other, maybe sometimes in unhealthy ways.
Yeah, sorry about that.
For public health information. No, that's the information that was out there. And in fact, you could say, because we had a PPE shortage in this country, I had already bought this before that shortage. But I have come back to that moment time and time again. I was sort of like, I think in some way I wanted you to say like, hey, great, cool mask and good job. And instead you're like, hey, idiot, like you're not supposed to be wearing the mask. And I was like, I just remember very sheepishly, I was like putting it in my bag, and that was that for the mask.
But it's funny, you had no shame wearing it.
Did
Nobody
not
else
be in
was
the
wearing
least, a
mask,
bunch of
though.
strangers. But if my brother 1,800
Yeah, I was on
miles
the-
away tells me not to do it,
Hey,
Yes.
That's it.
it's about, I think one of the frustrating aspects about me dealing with this entire thing personally has been like, and as you guys know, like, I feel like I'm very much a rule follower, and like that I'm presented with that. And I was like, oh, well, that's the rule. I'm going to follow the rule. And then the rule changed, and I was like, we got to get masks now. Like, we need masks now. And I was like,
I remember the first time my husband came downstairs with like a bandana around his face because he was going to go to the store. And I was like, no, they say not to wear masks. Like, they say that it's no good. And then he's like, no, they changed it. I was like, what? So,
yeah, right.
yeah.
I count on my wife. She knows she buys all of the masks. And I remember in February, I was riding the bus to work, and I saw somebody with a full respirator on the bus. And I was kind of like, look at this guy over here. And then that guy was wise up. He knew. So now it's like, in hindsight, I didn't.
Yeah,
feel
it's a good
bad,
thing
but-
he didn't call his brother.
Yeah.
Let's stay with this for a minute. We are a sort of an extended phone, text, social media tree as siblings. What are some of the other ways we were all communicating throughout all of this?
Well, we started our weekly Zoom calls.
Yeah, we started at the end of March.
Was it that early?
Yes.
Yeah.
It was right after Granddad passed. And so we called each other. We wanted to Zoom, and it just became a weekly thing,
Yeah.
which is really special.
Yeah.
And
Not
we're still
weekly
doing
now,
it.
but because we've all gotten busier, but I think it's still been a constant, which has been nice. It's like we talk to y'all, I see y'all's faces much more than I had in years.
I know.
And
Yeah, I was thinking about that. We typically don't see each other between April and October. I mean, sometimes if we're lucky, a summer vacation, we all get together. But, it's not like, I think this upcoming, Christmas break and like not getting to see each other over the winter is going to be really tough. But I just love that we've seen each other and talked to each other more in the past 7 months than we typically do. And it's, for a while there, it was every either Saturday or Sunday for at least an hour. And it was like the highlight of the week. It was the only thing that would break up for me or for our family. It was the only thing that we had on the calendar that was, because we didn't go out. We didn't see anybody. So it's like, okay, it's 4:00. Gotta get on the Zoom call. So it's pretty special that we, that is some positivity to come from it, is that there is more time to be able to connect because we don't have the other activities going on to distract us or
Yeah,
to take away
sure.
from that.
Yeah, was that weird for the sisters who all live, you live close by?
Mhm.
I think Scott and I have gotten used to, video chatting, for years now. But y'all, I don't see each other every day, but
We didn't see each other in person for was it 4 months?
not the longest you've ever not seen each
I
other.
think
Like,
it was
Yeah, by
or
far.
at least 3 months. That's the longest.
At least 3 months. Yeah.
And then we finally met up, and since all of our families have been, we've been all social distancing and not going in big groups, so we felt like it was safe and just had some sister time, and that's also been really important because we know we can entrust each other. But yeah,
But at the beginning, yeah, we didn't
yeah,
see,
that's crazy.
which is so hard because,
Everyone.
yeah.
How many? I hadn't really. I guess I hadn't thought about it quite that way. So you weren't physically together in the same space, Jen, Steph, and Lynn, for 3.5 months.
Yeah.
It was, I'm trying to think. I might have gone to see Lindy a little bit before, but definitely a month or two.
We saw each other. Well, it wasn't that long, Steph, because it was Jack's birthday. His first
Oh,
birthday. You were, and so that was the beginning of April.
But that was so weird at the beginning.
And that was strange.
What was
because
that like? Because
wrong.
those first encounters when you hadn't been in the same pod with somebody or have been super tense for people. Was it like that for you guys? I mean, you're twins.
I
Yeah,
wouldn't let Lindy hug me.
Like you
and
don't
I
hug
did
people.
anyway. I didn't
Was it
care.
weird?
Yeah, I was like, don't hug me. And she just ran up and hugged me. And I was like, this is weird. Even though guys, I never left my house. Like I think I went to HEB once in like 2 weeks and I saw Lindy like that, I guess the 14th day. And I was like, but what if I got it? But we calmed down. But that was kind of the best thing about the summertime is that all of us were home almost 100% of the time. So it did make us feel a little bit better. But at first it was very weird.
Mhm. And I think still you have that anxiety after you see each other, like, oh, my throat I have a tickle. I just saw them. Now did I spread them? Like, am I going to be responsible for being the super spreader? And, so it's just every time you do anything, at least for me, I feel like that anxiety and maybe a little bit of guilt, like,
Yeah.
okay. And so then
we've had to do that with daycare as well, just worrying about like our pod of parents. And Emmy Lou got sick about a week ago with a little cold and immediately got a COVID test, and was negative, but still brought her home for a lot longer than typical, I think, for just a common cold. And I think it's really strange this time period of like the risk, right, of what you're willing to do with not having a lot of good information about what is risky behavior. I mean, we know like the super spreading events, and try and like wear masks, don't avoid groups, keep your 6 feet distance, don't spend a lot of time indoors with other people. There's a couple of things you can do to protect yourselves, but like at what point do you just lock yourself in isolation and close the door? But I think we all tried that for like first couple of weeks, month, and then said, no, we can't do all of that. So the pendulum has swung, but I think America is trying to figure that out.
Yeah.
There's so many stories of, like to what Jeff said, like Jeff and I have lived outside of Texas for a while. So we're more used to just keeping up a strong relationship through video and calls. And then, the visits, like the physical visits are really important. But then, reading about these stories of families that, like they just couldn't, in Texas, for example, they just couldn't, and this happened in Jersey too, they couldn't stand to be away from each other because they were so used to the Sunday family dinner or whatever it was, and they got together, and some of those turned into super spreader events where members of the family got sick and died. And it's just like what you were saying, Lindy, it's like, oh God, the tension and pressure of that for siblings and families who are used to seeing each other on a regular basis has been a part of this. I don't think people have talked enough about. I don't know, Dave, when did you first see Fred? How long did you guys go without seeing each other?
We haven't seen each other. We've talked on the phone, and but he has seen like we've both seen the parents
Yeah.
separately, but we haven't seen each other. I mean, with with Caitlin being pregnant and all of that stuff, we were like super guarded,
Right.
and we would only do stuff that involved like being outdoors, being able to be socially distanced, being able to wear masks, like being in situations that we had complete control over every aspect, or almost complete control. Again, with the toddler, it's hard to have complete control of anything sometimes, as you guys understand. But we don't, I guess we never really had like that super close relationship of like, we've got to see each other every few days. Like, we both live our own lives and we like hang out, but it's like, we've just got this like nagging, plan to go golfing. Like, and it's like, okay, well, we'll do it. Well, maybe we'll try and do it in a couple of weeks. Oh, maybe we'll try and do it in a couple of weeks after that. It's like, we both celebrated our birthdays separately. Like that's one of the things that last year, now that everybody, like all of our family unit is in San Antonio, like last year we all got together for Freddie's birthday and made steaks and had a great time. They got to play with the boys. And like, that was just not at all on the like possibility this year. Not like, didn't even enter in the conversation. It was like, hey, text message for have a happy birthday. And that was it. Like,
Yeah.
I don't know, man. It's complicated, and I feel like you have to. Like, I'm willing to accept risks based on, and I hate to say this, it's scaffolded, so it's like I will accept this amount of risk for my kids, and I will accept a certain amount of risk for my work. And the reason I accept the work risks is because I still need that to like keep making the house payments, keep paying the grocery bills and all that other stuff. Like outside of that, it's like, well, you got to figure out where you land on the continuum of risk. And like, if I can't, like as Jeff alluded to, when it was totally crazy and everybody was trying to be shut in all the time. And like, finally it was like, nope, we've got to be able to go to the playground. Like we've got to go somewhere. We got to get out of the house and do something to burn off some energy. But man, other than that, like, not doing it.
Since you mentioned Caitlin, I mean, it's come up several times. Between all of us, we have a lot of young children. Dave, you have a newborn. Like, can you just share a little bit about that experience? And I'd like to invite others to talk about, the childcare things. I mean, we live all of this as siblings, but we also, one of the things siblings rely on each other for is like child raising advice. Like, what are you doing? What am I doing? What are we doing? But I mean, Dave, your situation, I mean, is pretty extreme. I mean, like Asher is like a pandemic era baby.
Yeah, he sure is. Sorry, my office phone is ringing and my cell phone now. But yeah, because the work never stops now. It's not your question. I'm going to treat this like a presidential debate. I know that was your question. I'll come back to that. I feel like
so
now
difficult.
there is zero disconnect from like work time and not work time. Like since we've moved home, like working from home more often, like my phone, like I feel like people feel like they can call me or text me at any time for work stuff now.
Dude,
we're all working whenever we can. And like, I don't want to be rude to somebody and be like, hey, anyway.
You need to take the call?
No, it's not important.
All right.
No. So I had a tremendous amount of anxiety with the whole baby and pregnancy thing, like to the point where we did a tremendous, and you're going to get angry emails after this, but like we did a tremendous amount of research about like at-home births and alternative birthing centers and different, like we were very much like, one of my sisters-in-law is a labor and delivery nurse. Like we are very much going to the hospital. Like that was the birth plan. And then as things blew up in South Texas and San Antonio specifically, I was like, I'm not going to go to the hospital because that's a place where sick people are, very sick people. And I don't like, what resources are they going to have available? Obviously they're going to do their best, but I don't want to be in a situation like, Caitlin's not sick. She's having a baby. Like she's not, like, this is not a danger risk space. I mean, I guess it's risky, but it's not like the same kind of emergency room need that other people have in this moment. And, ultimately things got better or whatever, but I was a complete basket case for a little while there of trying to hold it together of like, this is scary. This is a scary thing, but maybe it's going to be okay. And then it turned out okay. Like, and baby's healthy and every mom's healthy. And, she got she's having contractions and they're stuffing that thing in her nose for her COVID test before they can let her back into labor, like to decide it, like you go into door number 1 or door number 2 for your,
Wow.
and the processing all of that fear and anxiety about, okay, if you're COVID positive, they're going to take the baby from you and take it to the nursery. They're going to take and it's the fear of the unknown in many ways, but man, it was absolutely nerve wracking. And I think I've talked way too much. So.
No, not at all.
Did she have to wear a mask the whole time during delivery?
She did. She wore a mask, so we were prepared with everything. So I bought face shields. We had cloth masks. We had surgical masks. We had N95 respirators because I just didn't know what it was going to be. And she ended up wearing the cloth mask, and everybody, like the labor and delivery team, the doctors, were all in full PPE the whole time. And I mean, she handled it like a total champ, and but I'm sure it was uncomfortable. Like she will never admit to it. But yeah, she labored in a mask. And
Comfortable without the mask. So.
Yeah, I mean, absolutely. You obviously know way better than I do. But I just there was never an expectation when we went in. Like they were like, okay, so here are the ground rules for what you, and they didn't say it like this, but like, here are the ground rules for what you need to be doing while you're here. There was never an expectation that she wasn't going to wear a mask for our own safety. Like, I don't know who else you're around, like what else is happening in here. Like, again, it's a big building full of sick people. So.
But you were able to be there with her, because I've heard stories about fathers not being in the same room or being admitted to the hospital.
Yeah, absolutely. Yeah, that's a great point, Jeff. And I know that there are other people that weren't as fortunate as us. But yes, you were allowed to have one support person. So her sister, who is the labor and delivery nurse, I mean, this is a credentialed professional who does this for a living, was not able to be with her because she doesn't work at the hospital that we delivered at. So she was going to have to get a doula certification or something like that to be able to, I can't remember the specific language, but it was like, there was very specific language that I think is actually enshrined in state law or state statute now of these are executive order from the governor. It's like, you can have one support person and one registered doula, I think is the language that they.
When Emily was born, it was the middle of a really tremendous fire season in California in 2018. And it was November, and I thought it was bad then when we looked out the windows and everything was hazy and was orange, and she was born into this kind of environment where we had to take her home and like rush to the car as quickly as we can and stay. We were locked in for 2 weeks, couldn't leave the house. I thought that was like apocalyptic. And so hearing your story about, bringing a child into the world during COVID is just absolutely insane. Good on you for getting through that.
Yeah, I mean, I had the easy job there, but we had and you guys are gonna make fun of me, that's fine. But like we had our little essential oils diffuser and like the Bluetooth speaker and like made it home. And honestly, like the people were great. Like the mother baby unit was like a whole different world set apart from the rest of the world. It's like I had somebody that came in that took care of this little person that just came into the world who has no idea, has never known a world that didn't have COVID. And like, none of this is weird. None of it's strange. Like, I mean, to be totally honest with you, like when we left, I was like, oh man, that was really easy. I don't know what I was scared about. That was really easy. So
I wonder, for other, I mean, just to get in some of the child care kind of stories that are, related to that. Like the first time that Mercer went and had a play date with a friend, for example, it was just like, it's just like this tension, like these very normal things. Like, and I think this has been also like maybe Steph, to this issue about getting kids back to school. Like, children need to be with children. Parents need for children to be with children. But that tension of that sort of, not even just the first time, but like, you know, at our house, we're rule followers too. Like we take all this very seriously. And, you know, Gabriel and Mercer have had to really adapt to that. I don't know, like Steph, what it's been like to talk to parents through this time. You have a lot of anxious parents probably contacting you, asking, is it safe to send our kids back into your classroom?
Yeah, and they're so nervous when they do. But I will say, like, it's been incredible to watch because we all, you know, I don't know about y'all, but I complain every 5 minutes about my mask. Hot and I have a pimple now because I'm wearing it. These kids, they come to school at 7:30 or 7:45 and they keep their mask on the whole time and they play hard on the playground with the mask on. And I never have to remind them. And it's just really cool to see how they can adapt. And you know, they're learning on a computer in a classroom and they can't share anything, but they're happy as can be. Like the first day I went home just crying because I was like, this is the worst day of my life. This was the worst, like, school experience. These kids are probably miserable. And I got an email from a parent that said, my son came home and was so happy and said it was just the best day of school he's ever had because he was back at school, you know, and some of that just kind of like he got to see kids because they hadn't seen anyone, you know, since March. And so it just kind of put things in a perspective of like, it just, I don't know. And I know most of those parents, they email me and they're like, okay, tell me truthfully, should we send them back? And I'm like, I can't make that decision for you because I don't know.
Yeah.
But we're trying our best. So, but it is really amazing to see kids figuring out ways to still be kids and play with each other and doing it safely, better than most adults are doing right now.
Jen and Lindy, seeing some of you've had cousin get-togethers, right?
Mm-hmm. Yeah. We, Jack and Donovan finally got to play together like a couple weeks ago, and that was good. It's impossible to teach them about social distancing though, but so we're all fine. But it was nice to actually get them together again. And then Donovan's seen his other cousins on the other side that are older and have been homeschooled and staying home and stuff too. So we felt good about that. And it is important, I think, just to have him be around other kids.
Yeah.
But
particularly cousins too. Like, I mean, this is one of the things that really has been hard for me in this time because, you know, we usually will make trips to Texas and a couple times a year. And the last few years it's been more frequent because new members of the family coming along. And my kids are a little older than yours, but they're old enough. They're at that cool, old enough age where they can be the cool older cousins, you know? And like, we were planning to be there for Texas football game.
Yeah.
Would have been happening in just a couple weeks from now with my dad and all of us, and then, you know, tailgate, and we did that last year and we were going to do it this year, and I just was so looking forward to the big cousin meetup, you know. And I mean, we can do that in the future, but that's been hard for me, that part.
Yeah, Amy Lou has still liked and really enjoyed the video chats, though. I think her attention span has probably diminished since we started, but she really, I mean, her time with grandparents, I think, is also, she really loves hanging out with cousin Jack since they're the closest in age.
They love each other.
But, you know, Mimi and Pops, that's important time, and she's, you know, really likes that time with grandparents on the video screen. But yeah, it's just been a weird evolution, you know, from March to now. You know, she was like just learning words at the beginning. I mean, her 10th word was mask. You know, and now she's wearing a mask at daycare. And I think, like Stephanie said, I mean, doing better, probably better than I would be if I were in her shoes. And because she sees all the other older kids at daycare wearing it all day, and so there's a good like social reinforcement happening there that she doesn't fight it. She puts it on, and to be happy about it. So I think we have to cycle through a couple of them a day, but yeah.
That's one thing I noticed about the Zoom calls from the very beginning, is that which was really cool, that instead of like doing it like we're doing now, where everybody goes around and sequentially sort of tells what they're doing in their life, it very quickly just turned into like whatever's happening is happening. So it was like Zoom portal into these different universes. And you remember, like we spent a lot of the first ones that we were just playing ping pong. Do you all remember? Yeah. Like I just had the camera on and we just had like ping pong going, because that's what we were doing at our house.
And your garden.
Yeah, and then I still have tomatoes up there actually. Yeah, but that's what we were doing.
Scott, I've been meaning to ask you this, and I'll just ask you in front of the whole group. So early on in this deal, I felt like the most reputable information I was getting about COVID-19 was coming from these calls. And I remember it was very important every day to make sure I was listening to this. And I was like, I got to find out what's happening, what the newest thing. I couldn't digest enough information. And I felt like at least the information coming from your calls was going to be truthful and accurate and on point. And I really appreciate that. My question for you, because you are kind of since you were the oldest in this crew and the one responsible for making sure that we are all at least sort of staying on the right track, like, what's it been like for you? I mean, what have you been feeling like, knowing that you've got brothers and sisters scattered all over the place, and you're, trying to keep us all? I guess I should out you that you're a worrier. So.
Yeah. I have been particularly worried about you all in Texas. And, because I think you have bad political leadership there. I'm not saying anything I haven't said on this program before, or to each of you with more colorful language over these last few months. And it's not that I think you would do the wrong thing. It's that I think you've been put in many cases, and I won't speak to particularities, but each in your own way, I think you've been put in almost impossible situations in these last few months if you follow the rules and other people don't. And I think it's also created situations where there's sort of generational issues. So that has caused me some deep concern and some anger. It's hard for me to lash out against the lieutenant governor of Texas from here. I do it on Twitter. I guess I yell into the void, and have done COVID calls with, if people go back and look, I've actually had a lot of Texans on, little sort of sub theme throughout COVID calls, as I've had a lot of Texas guests, and Texas has been a theme throughout this. This has been a way to cope in some ways for me doing the COVID calls, because at least at 5 o'clock every day, I knew I was going to talk to people who really cared about what was happening. And probably more than you all realize, like the text messages and the Zoom calls and the, wherever we find little bits of time to communicate, like those really matter a lot. But the distance is real. I mean, I talked with Olivia Troy yesterday, and it was an amazing conversation. I mean, she was in the coronavirus task force. This person spent months working in an administration that has done unspeakable things, but she was actually like one of many thousands, like doing her job. And I thought the most moving part of the conversation, so her mom lives in El Paso, was she talked about her mom. So, and how distant she feels from her mom. So I guess I know Jeff kind of said it earlier, like I've kind of grown up and kind of am used to being physically distant, but as close as possible with each of you. And it's been really hard these last 6 months to feel like I couldn't, if I needed to, get on a plane and get down there or get to California. And I would have seen each of you at least once under ordinary conditions because of research trips or whatever. And it hasn't happened. And every one of those trips that's missed is a huge loss to me. So
I think it was true before we all had kids, but now kids are growing up so quickly as well. It's like these major milestones. First birthdays get missed, second birthdays are going to get missed. You just don't get that time back with family members. And it can't, it's great that I think it's great that we have this technology that allows us to do video calls, but it's just not, it doesn't replicate
It's not the
being
same.
in person.
We're almost up on time. I just want to remind everybody you've been listening to me talk to my brothers and sisters for an hour on COVID calls on the 150th episode. And we would be remiss if we didn't at least talk a little bit about parents. And I'm going to give the first word on this to the toughest member of the family. Everybody knows who that is. It's Lindy. Yeah, if it's time for a tough talk with the parents, I'm talking about the Knowles side here, and then we'll come to you, Dave, because you have that on the other side. We send Lindy in, and I think this has been an experience a lot of people have had during these times, because older people are at greater risk, statistically speaking, and people in minority communities and older folks are at greater risk. What was it like talking to the parents about COVID-19, Lindy? I'm sending you in also because if there's any criticism later, it's on you, and I know that you can
I can handle it. I'm not worried.
Our parents are wonderful. I just put that down at the beginning. It's been amazing to be in touch with them more too. But go ahead, Lindy, because there have been some tough talks, right?
Well, so I think all of us have kind of balanced, like, what should we say? You know, what do we want to say but still be respectful because they are adults? You know, our parents are wise and they make decisions for themselves, and they're watching, you know, statistics, and they're being very smart. But it's also, it's difficult. It's just kind of, it's sometimes you have to say, like, okay, please don't go to the grocery store. There are HEB deliveries, or please ask Steph and Jason, who are 30 minutes away, to pick up something for you. You don't need to go to the store. But I mean, I think, like, yes, I get labeled as the tough person, but honestly, I am not. I really tried to be respectful because I also don't want to be patronizing, or come off that they're doing anything necessarily wrong. But I also want to kind of reiterate that, like, we're all making these sacrifices. One of the main reasons that we kept Jack at home was so that we could see our families. And so, you know, we're doing a lot of sacrifice. So if you could do curbside pick up for HEB rather than go in the store, or, you know, if you could just be careful, you know, things like that. But I haven't, I guess I just don't want to claim that I've been tough or have had like those hard conversations, because I really haven't. I think I've just done more of like reminders of like the things that all of us are doing. Right, Steph? Is that fair? I think Steph actually has seen the parents the most out of everybody.
Yeah, we see them weekly, which is great. But I mean, that's exactly right. Like they're doing really well, actually. Dad walks in with his mask on and they keep it on the whole time, and they're never in our house for longer than 30, 45 minutes. But yeah, I think Lindy's right. Like, you just have to remind them, like, you don't have to go to Bed Bath and Beyond, right? Like, I don't go there. I don't go shopping. There's Amazon, you know? So it's just kind of just the reminders that I think we do with everyone, and it's just in a loving way. So, but yeah. Lindy's the tough one, though. She can just talk to him.
No, and I'm teasing Lindy, but it's that what you said about the wisdom is important. And, you know, Dad has been super prolific in this time, writing essays.
Yes.
Like they're taking advantage of this time in ways I wouldn't necessarily have predicted. And also they have a new resident living in their home.
Yes.
Right?
Meemaw. So our grandfather passed away at the beginning of all this, which was really difficult. So that has been, you know, another layer to everything, is getting Meemaw moved in from Paris, Texas, them having to deal with the, you know, the grief and, you know, all of the, just everything that comes, losing someone so important to all of us. But then having Meemaw come in, move with Mom and Dad, which has been awesome for us to be able to see her more. So, but another huge reason that we've all been so careful, so we can see her and not put her at risk.
Dave, can I put you on the spot just for a second to talk about talking to parents in these times?
And I just wanted to share one quick thing that I felt like was, so at the very beginning of this, and I guess I should have talked about this at the beginning piece, but I remember driving to work one morning and listening to too much NPR and digesting all of this before we had gone into lockdowns. And, I was talking to my dad on the way in to the office, and I was talking to him on the phone. I was like, look, man, they were still shopping. They were still going out. They were still doing everything, pretending like nothing was going on. I was like, look, I'm not ready for you to die from this. This was the language I had to use with him. So he knew that I was serious. Like, I'm not ready for you to die from this. I need you to stick around. I need you to do these things so that you do stick around. And, he lost his dad very young. And I didn't want to, I wanted him to know how serious I was. And that was it is truly a life and death situation. And I'm just not prepared to deal with that. And especially with the new one on the way, I was like, I can't take this. So it's my tough talk, channeling Lindy, I guess.
Well,
you're way tougher, Dave.
Every family has the one child. I mean, they listen to all of us, but every family has that one. And in the Vieira household, if I have a message that I really need to get through, I filter it through Dave. I'm glad you did that. And they've been great, and they've followed the rules, and it's been hard for them. Because these are people who are retired now, and they're ready to spend time with their grandkids and with their friends, and they're stuck in the house getting groceries delivered. It's not fair.
Oh yeah, super bored all the time. But the promise of getting to hold new grandbabies certainly helped skew.
Strong incentive.
Yes.
Strong incentive. Well, we have to wrap up. I've kept you 10 minutes too long, and you have other things that you need to do. But let's just do a quick round out. Anything we didn't cover that you wanted to say, or something you look forward to in the next couple of months as we keep going through COVID time? We're not even towards, I hope we're halfway done with this. We're not towards the end of this yet. Steph?
I think my biggest thing is that I'm just so thankful for y'all. And I'm going to get teary-eyed, but I just really do think, and for people that are watching this, I hope that you reach out to your family members or close friends and really take that time, because it's there. And, we don't do it every week, but it is the highlight still of our time together, is just seeing each other and kind of having a little bit of normalcy. I think that's what we're all craving, is just a little bit of regular life. So, and your family is there for you for that.
Well said.
Oh, I got teary-eyed for that.
We did.
We're Knowleses, it's fine.
We're emotional.
Knowles girls.
I can't top that. Anybody else? Well, there you have it. 150th episode. Steph gave us our marching orders. Reach out to family, friends, and keep everybody close in this time. Love you all.
Love you.
You can catch COVID calls every weekday at 5 p.m. Eastern time, and we'll be back on Monday. So catch us then. Stay healthy, everybody. And thanks again for this 150th episode.